watching the Daily Roundup by People's Dispatch, where we bring you some of the top stories from around the world. Let's take a look at the headlines. El Salvador's president to extend state of emergency for second time. US state of Oklahoma passes law banning most abortions. Nurses and midwives go on strike over low wages and poor working conditions. Israel kills 16-year-old Palestinian teenager in violent raids in Nablus. El Salvador's President Nayib Bukele will ask the Salvadorian Congress to extend the state of emergency in the country. If granted, the extension will be the second time since the month of March that emergency provisions will go into effect. The Congress had extended the emergency the first time on April 25. The state of emergency was first put into effect with the government citing the high murder rate in the country as a cause. The government first enacted the state of emergency in the country after a pact reportedly between the government and the MS-13 gang ended, resulting in a spike in violence. Subsequently, the country witnessed 87 murders in just one weekend. The government has reasoned that the emergency is needed to keep the murders in check and maintain law and order. But human rights groups have warned that the extension of the emergency will lead to a further decline in the human rights situations in the country. According to the NGO Cristosal, from the end of March till date, it has received over 700 complaints of human rights violations. Since the emergency has taken effect, the government has claimed that it has arrested more than 34,500 suspected gang members. Hundreds of rural women even marched to the capital to the Supreme Court of Justice to demand their relatives' release. International rights group Human Rights Watch has also expressed concern over the steadily rising number of arbitrary detentions and enforced disappearances, as well as 2 reported custodial deaths. The US state of Oklahoma on Wednesday, May 25th, passed into law the banning of abortions starting from the stage of fertilization. Republican Party Governor Kevin Stitt signed the bill into law, which would also allow private citizens to sue into abortion providers who knowingly perform or induce an abortion on a pregnant woman. Oklahoma's law is being termed as the most severe abortion restriction currently active in the United States. The law allows for exceptions for the life of the pregnant woman being under danger or for cases of rape and/or incest reported by law enforcement. Oklahoma's law is the latest in series of bills being passed by Republican-governed U.S. states to severely restrict or completely ban abortions in their respective states, in line with the conservatives' pro-life agenda. These flurry of new abortion-related laws come in the wake of a leaked draft opinion of the U.S. Supreme Court, which would overturn Roe v. Wade, which legalized abortion about 50 years ago. Oklahoma's law is reportedly very similar to a law passed by the state of Texas, which bans all abortions after 6 weeks of pregnancy. Moving on to our third story, nurses, midwives and other health workers in Uganda have gone on a strike over low wages and poor working conditions, joining thousands of allied health professionals who are already on strike since May 16. Uganda Nurses and Midwives Union (UNMU) announced the launching of the strike despite a letter from the Ministry of Public Service asking them to halt the industrial action. UNMU President Justice Chirop Kiplangat in a statement said that the health workers and nurses have gone on strike because the government is undermining them and neglecting their demands. Speaking about the letter, he stated that it was not telling how much nurses are going to earn. It was just saying we shall enhance salary. So it doesn't give us hope. We want to know how much they plan to enhance our salary. Doctors have been given already, the science teachers were given, so nurses are not aware of how much they will be given. Around 30,000 health workers and professionals in the country, such as medical clinical officers, clinical psychiatrists, laboratory scientists, radiographers, records officers and dental technicians went on strike on May 16, demanding better wages and improved working conditions. Nurses and midwives joined their strike over the disparity in wages between them and medical doctors. The UNMU president also spoke about this vast disparity. saying that a nurse with a degree gets 2 million Ugandan shillings, while a medical doctor with a degree gets around 4 million Ugandan shillings. He says this makes the nurses feel less valued even though they spend the same amount of time in medical school to obtain their degree. He demanded that nurses' salary be increased to 4.8 million shillings in the next financial year, as doctors are currently drawing a salary of 5 million shillings. The World Health Organization has also recently asked the government to swiftly intervene and address the demands. It has warned that the strike will have devastating effects on the system and quality of healthcare, especially for the healthcare that is very timely needed for mothers and newborns. Finally, in the early hours of Wednesday, May 25, Israeli forces shot and killed 16-year-old Palestinian Gaith Rafiq Yamin in the northern city of Nablus in the occupied West Bank. The teenager was killed during a raid by the Israeli forces in the city following protests by Palestinians against illegal violent storming of the St. Joseph's tomb by Israeli settlers. The settlers regularly tried to forcibly visit the site while being heavily armed and with the protection of the Israeli security forces. News reports stated that at least 80 Palestinians received injuries at the hands of the Israeli forces during the raids. The Palestinian Ministry of Health in a statement later said that Yamin was shot in the head at approximately 2 a.m. in the vicinity of the St. Joseph's tomb. It added that the teenager was rushed to the Rafidia hospital in Nablus for surgery for his headshot wound but succumbed to it 15 minutes later. His killing takes the total number of Palestinian children killed by Israel this year to 12, according to Defense for Children Palestine. The head of emergency department of the Palestinian Red Crescent Society, or PRCS, Ahmed Jibril, stated that among the Palestinians wounded, 67 suffered from suffocation after inhaling tear gas fired by the Israeli forces and 19 were injured by rubber-coated metal bullets. The Israeli forces also attacked an ambulance present in the area with gas bombs, which was transporting a pregnant woman to a hospital who had just gone into labor. Protests by Palestinians and attacks against them by Israeli settlers and security forces have been taking place regularly due to the illegal and provocative visits of the right-wing, ultra-nationalist settlers to the pilgrimage site. Even though the site falls under Area E, which is under full control of the Palestinian Authority, the Israeli military facilitates these settler visits. On the other hand, it severely restricts and at times prevents Palestinians from visiting and worshipping at the site. Settlers, who are often equipped with guns and other sophisticated weapons, have also attacked the Palestinians on several occasions in the past. The settlers were seen firing live rounds on Palestinian-owned cars in Nablus today as well. The Palestinian residents of Nablus reportedly tried to fight back and defend themselves by throwing stones and Molotov cocktails at the Israeli forces in the clashes that ensued following the raids. Some news outlets reported Palestinian fighters firing back at the invading soldiers who were seen using live fire ammunition on the protesting Palestinians. And that's all for today's episode. For more such stories, visit our website peoplesdispatch.org and follow us on Facebook, Twitter and Instagram.